Okay, we're back. Spinal cord injuries. Are you ready? All right, here we go. For spinal cord injury. So I'm a chiropractor and I deal with spines all day. I'm also a paramedic, and when dealing with spines all day, as a paramedic, sometimes you see the spinal cord injury where it's actually a broken bone. In the chiropractic office, then we'll see people with neck pain, some issues with the spine. Maybe their spine's like twisted the wrong way. Maybe the spine has pain, right? The spine's not moving properly. So if you look at all these segments should be moving, right? That's how we can actually bend over. If you think about it, if you just had a stiff spinal column, we wouldn't be able to move, right? You wouldn't be able to rotate your head. You'd break the bone to be able to move the head, right? If we didn't have these movable segments in our body, if we just had one column of bone with the spinal cord on the inside, we wouldn't be able to move, right? But since we have the disc spaces in between, we can actually bend, right? We can actually rotate. So it's amazing. When you look at and study how the body is designed, it's just amazing how we're designed. That we're designed for function, we're designed to heal, we're actually designed to really prevent trauma, which we'll talk about in this section. It's just amazing. So when you look at the spine, the neck area is called the cervical spine, the mid-back is your thoracic spine, right? The lower part is your lumbar spine, and you have your sacrum, and then your coccyx. So just move out of the way there so you can see cervical, thoracic, lumbar, sacrum, and coccyx there. So that's how the spine is made up, okay? So we want to get information from the person that they're having this issue, that they're having a spinal cord issue. So let me just go to our next slide here. Yeah, so you can see with the spinal cord injury, the problem that could result is that they could become paralyzed. So if someone's paralyzed, that means that the person can't move their legs or they can't move their arms, right? They can't move a part of their body now. Okay, so the spinal cord actually supplies the function to the muscles. All those nerves go to communicate. So if the spinal cord is cut or punctured, then it's interfering with the communication tracts that run down the body. And that's why someone could become paralyzed. So what we want to do as a first aider, we want to make sure that we're holding the person's head, right, keeping them still so that they don't move. So what I want you to do, I want you to send me a text message right now, and I want you to tell me what are some things that could cause a spinal cord injury. Okay, so my number is 519-919-9235. Okay, so send me this text message now and tell me what are some mechanisms of injury. So that's a word that you should know. How the person got injured. The mechanism. How. So the mechanism of injury for this guy is the car accident. The mechanism of injury for this guy is a motor vehicle or a motorcycle crash. Mechanism is falling down the stairs. Okay? So I want you to write down right now and send me a text message, 519-919-9235, and tell me what is a mechanism that you can think about that could cause a broken bone and spinal cord injury. Okay, so I'm going to pick one, diving into a shallow pool. All right, is that one up there? Slip or fall. Diving into shallow water. Ah, it's already there. Okay, so I'll pick another one. Oh, in UFC, in the wrestling, where they take a chair and smash it over the guy's neck. All right, so that's mine. That's one that could cause, that's a mechanism that could cause a spinal cord injury. That's a cause. So mechanism and cause are the same thing. Okay, so send me a text message right now, 519-919-9235. What is a mechanism that you can think about that could cause a spinal cord injury? All right, so that way we can keep it live. I'll respond right away just while we're thinking about it. All right, so for this person who has fluid coming from the nose, the ears, right? We had talked about the cerebrospinal fluid, right? So is that the fluid, the brain fluid coming out? Is that the brain fluid coming out of the ears? If so, right, any fluid leaking out of the ears, we can take a piece of gauze. I call this first aider's toilet paper. And we're going to put it over the ear and tape it into place. And so we're going to just tape it loosely into place, and that will catch some of the fluid coming from the neck, or sorry, coming from the ear or the nose like that. Okay, we can hold it against their nose if it's coming from the nose, but we'll tape it around the ear. All right, so then we want to make sure we're holding the person's head for sure. So here's a picture of you holding the head, and then you can see the one down there, the person is on the ground, and so we're holding their head, or getting down on our knees, holding the head like that so it doesn't move. So anytime you think that there could be a broken bone or a neck injury, we have to take spinal precautions. So what does that mean? The precaution is to hold their spine so it doesn't move. If they try to move, you hold it still so it doesn't move, and you say, just stay in this position, wait for the paramedics to come. Okay? So that's what we're going to do to make sure that they don't injure themselves and become paralyzed. Because if the bone is broken, say it is broken, and they go to turn their head and it severs their spinal cord, now they're paralyzed. Okay? So we're going to find maybe someone laying face down. So in general, we don't move people. So in general, we don't move people. We keep them where they lay and let the paramedics scoop them up from there. But in this case, let's say the person's face down and they're not breathing and they have a neck injury. How do we get them on their back? Well, this picture shows us how we're going to do it. So one person's going to hold the head, right? So you're going to hold the head, and then we're going to roll the person over on their back like that. So we need another person to help us, someone grabbing from the shoulder and the hip, and we're going to roll them over like that on a count of 3. So good communication, rolling them over, keeping their head as in neutral position as possible, right, without moving it. And that's how we're going to roll somebody. And then you can check if they're breathing. If they're not breathing, you can do CPR. Right? So we get there. Let's say the person falling down the stairs. You get there. You say, hey, wake up. Are you okay? They're not. Okay. Help. Call 911. Grab a defibrillator. We check if they're breathing in the position that they're in. And if they're not breathing, that's bad. We have to roll them over on their back. So if they were breathing, we would just hold their head and treat them in the position face down so we don't have to move them. Okay? So if someone has a head injury, we're going to treat it as if it were a spinal cord injury. Yeah, we're going to actually treat it as if it were a spinal cord injury. So the depressions in the skull, so remember during our head-to-toe assessment, we said that if a person had a depression in their skull or a weak point, so now you can see here, person having compressions like that, maybe something hit their head like this. There's also fractures that can come in the jaw, right, and around here, so you see that in the picture here. So this one here, coming around here, you see the Lafort fracture, it's called. So if you want to look that up, it's called the Lafort fracture. So you could fracture here, you could fracture across here, right, like you see in this picture, and on the other side. And if that happens, your face basically falls off. Yeah. So your skull is here and you have fractures here. This part of your face is going to sag down, and you think about all the nerves that are going to be stretched and everything, so it's a very unstable fracture. You want to stabilize the face, basically. We're going to hold around here, we're going to hold here, and stabilize their face. But if that's not the problem, we'll just hold the head like that. So we want motion restriction. We want to limit the motion in their neck, and in this case, their whole head. Yeah. So this person, he hit his head. He hit his head on the windshield, and now he has these types of symptoms. So lacerations, concussion is the shaking of the brain. He has a skull fracture, fluid coming from the ears, paralysis, and unconsciousness. So those are some symptoms that could come as a result of hitting your head or having a head injury like this. But what do? We treat all head injuries as if they were spinal cord injuries, and we're going to come in, get in the back seat of the car and hold the person's head like that. So for head injuries, here's our treatment. Immobilize the head in the position found. So that might be a new word, immobilize. So immobilize means not to move. So immobilize, okay, so that they don't move. So I responded to a car that got flipped upside down in a ditch just a couple days ago. It was right on EC Row, just outside of Bell River, Patillo Road there. And so what happened was a guy was eating a blueberry. It went down the wrong pipe. He started choking. He swerved, and he hit the back of a car that was just beside him. That car flipped upside down, or that car went into the ditch and flipped upside down. So don't eat blueberries while you're driving. So, but as I was coming, I saw people running over to the car. And I looked and I saw that the car was upside down in the ditch. So I pulled over. I had my equipment with me. And so I grabbed my bags, grabbed my trauma bag, and I went over to help. And so when I got there, the people had already been taken out of the vehicle. Right? So in general, we should keep people where they lay, but in this case, the people brought them out of the vehicle, so you can only care for people where you find them, and I found them on the side of the road. So when I got there, I surveyed the scene. Right? The scene was safe. I looked over at the car. There's a little smoke coming from it, but it wasn't on fire, so that's good, because on TV, the cars always explode, right? So I treated them where they lay, asked them if there was any neck pain, any injuries, and the only injury that the guy had was some blood on his knee. So I gave him some gauze to hold on to that, and then the lady had bit her tongue and had some chest pain from the airbag hitting the chest, and so we were able to help them until the paramedics got there. All right, so those are some situations you might have to respond to. And now you can feel comfortable that you can go in and help somebody. But minimum, call 911 and you're fine. All right, so let's get back into it. So shock. Shock is a life-threatening condition. Yeah, shock is a life-threatening condition. You're probably thinking, wait, wasn't I shocked when someone threw me that surprise birthday party? Yeah, so that's a different type of shock. So we're not talking about that shock where people jump behind the couch and say, surprise! Right? We're talking about shock, the life-threatening condition where your body's vital organs don't get enough oxygen. Yeah, so when you think about shock, okay, my body's vital organs are not getting enough oxygen. Why is that? Well, that's the question we have to answer to find out where it's coming from. So if you take a look at that picture, you see how there's no blood in the upper part, or a little bit of blood, and then there's more blood pooling down in the body. So that's kind of what happens. The blood is not getting to the vital organs, so the heart, the lungs, the kidneys, the brain, right? And so these organs are going to start to break down if they don't have oxygen, right? So you start to show shock signs and symptoms. And so shock can be because of severe bleeding, right? That's actually the most common type of shock, is because of blood loss. It's a low volume shock because you're losing volume from your body. So the blood's squirting out, so there's less blood in your body. So this is the question. Why are my body's vital organs not getting enough oxygen? And maybe it's because I'm bleeding externally. I have blood squirting and now the blood's on the ground. Well, we said that the blood was at train cars, and now that's why my body's vital organs aren't getting enough oxygen. Does that make sense? All right, so then low volume could also come from diarrhea. It could also come from dehydration. You're losing fluid from your body. And then burns and vomit as well. So burns, you get that blister that forms. So has anyone ever had a burn where you get that blister form? Well, that fluid has to come from somewhere. So it comes from the blood system, right? And into the burn like that. And so that wherever it's leaving, coming from it, it's leaving a low volume there, and so that would be a low volume shock. So severe allergic reaction, heart attacks, excessive fear, anger, grief, right? We call that the psychogenic shock. All right, so those are different types of shock. So here's a shock cycle, and so you see as the cycle goes around, right? So we see that the person is restless, thirsty, they get pale, cool and clammy skin. Right? So as they're losing blood from the body, maybe they have internal bleeding on the inside and you don't even know, but they're starting to show these kinds of symptoms. So at first they're restless, they're thirsty, they get lightheaded, right? You're wondering why. I don't see any blood leaking from the body. Maybe it's bleeding on the inside. Okay, so then they start to have fast and shallow breathing. They have fast and weak pulse. All right, so you feel the pulse. We said the pulse should be between 60 and 100, right, for an adult. So that's why we talked about that before. Now when we talk about these specific conditions, we know that the person's pulse is fast. It's higher than 100. Okay, and it's weak. Why is it weak? Because blood's laying on the ground and it's not a lot of blood hitting against my finger as I try to feel for the pulse. So that's why they'd have a fast and weak pulse. Fast and shallow breathing, they only have a little bit of blood in their bodies. So that blood has to go around faster and faster and faster to be able to do what all the blood used to do. So you have 6 liters of blood in your body. Men have more blood than women. Women for the menstrual cycle will fluctuate. Right, so let's say there's 6 liters of blood, 5 to 6 liters of blood in the body, right? And you've bled 2 liters of blood, like a whole pop bottle of blood on the ground. So now you only have 4 liters or 3 liters left, right? That little bit of blood has to do what 6 liters, 5 to 6 liters used to do. So now it has to work faster. So that's why the heart has to beat faster, right? So that's why the person breathes faster to get more oxygen into their body. Okay, so those are some shock signs and symptoms. Homeostasis is the body's ability to maintain normal reactions, and that fails. They become unresponsive, the heart fails to pump, they go into a coma, and eventually they die. But as a first aider, you can stop this cycle you can chop it right there and treat for shock right away. That way it won't progress on to the rest of the cycle. All right, so you have the power to do that now. So this person is laying there. We said that they're responsive, so they're going to lay on their back. The unresponsive person can go on their side. All right, so we're going to treat for shock. We need to find the cause of the shock. So if it's blood loss, we need to apply direct pressure to the bleeding. Yeah. All right, so that's those are some things that we can do. So bleeding externally, if someone has external bleeding, then they're bleeding from arteries, they can bleed from veins, and they can bleed from capillaries. So you can bleed from arteries, veins, or capillaries. And so yesterday we had talked about the capillary, oh no, that was today. Yeah, capillary refill. So those are the small vessels. If you have bloodshot eyes, those are the capillaries. So that's bleeding from arteries, bleeding from veins, and bleeding from capillaries. Excuse me. All right. So I want to show you some bandages. All right. This is a roll of gauze. So in the picture you see them putting some gauze down first, and then using the roll of gauze to secure it in place. So let's say someone has a cut on their hand. So what we need to do first is put a dressing down. So there's a difference between a dressing and a bandage. The dressing is like salad dressing. It goes on top. So we're going to put that on top of the bleed. And then we're going to take a roll of gauze, and we always want to wrap around. Okay, so I'm bandaging up the hand, just like this. Rolling all the way around. They might want to use their thumb, so you might want to give them access for their thumb to move. So that's how we're going to do it. Just rolling all the way around. And that's a hand bandage. There we go. So this extra fabric at the end here, you can tuck that in. You can tie it or tape it down. So now the person has their hand bandage. So that's the basic bandage. You're just going to wrap directly around the body. But we always need a dressing, and we always need a bandage. So we go back here, we need a dressing and we need a bandage. So here's the dressing, right? So the dressing is bigger than the wound. It's absorbent, it's lint-free, and the bandage is something that can wrap all the way around and secure that bandage in place, secure that dressing in place. Okay. So for cleaning wounds, if it's a small wound, we definitely want to clean it. But if blood is leaking out, we just grab tissue paper, whatever we have, a towel, and hold it on there. Okay, that's what we'll do if the blood is actively leaking out. But if it's just a little cut, we can wash it. You can use soap and water. Some of the books have kind of got away from just soap and water and using more like an antibacterial kind of soap. But we definitely want to use water and clean the wound, okay? And then we can put like some kind of antibacterial stuff on it after that, okay? So then, hold on, let me go to the next one. Yeah, so the way we're going to treat bleeding is direct pressure and rest. Direct pressure and rest. And so we're going to direct pressure, rest, and treat for shock. So that's how you're going to treat bleeding. All right, so we apply the direct pressure like on the hand with the bandage. We put the dressing down first, and we wrap the bandage, and now it's holding direct pressure onto the bleed. All right, so that's good. We always want to check the real way to bandage. Before we actually put the bandage on at all, we need to check the capillary refill. Okay, so to check the distal circulation first, then bandage it up, then check it again. And if you wrap this so tight that you're cutting off blood supply, then your capillary refill is going to change. Right? Maybe the blood doesn't come back in there. Then you know your bandage is too tight. Okay, so that's how we can find that out. And so we talked about tourniquets yesterday. Someone mentioned a tourniquet. And so for a tourniquet, that's tying something so tight that it cuts off blood supply. And so we're actually going to use that only as a last resort. Okay, only as a last resort, and we talked about the reasons why yesterday. So if someone has a bump on the head, so I'll go through this a little bit quicker. These are just separate conditions. So what is a condition? How do we treat it? What is a condition? How do we treat it? So if someone has a bump on the head, we're going to give them an ice pack, and we need to hold their head still, assess to see if we have any kind of spinal cord injury. If someone is bleeding from the ear, we're going to tape a piece of gauze loosely in place, just like that. And so if someone has an embedded object, something stuck in the body, then what we need to do is we need to put padding on either side. So you see the picture there. So let's say that someone has a piece of wood stuck in the body. All right? Or let's see. Now I have something cool here. Let me find it. Oh, okay, I don't. I had a knife around here somewhere. Oh, there it is. Look at that. Ah! All right, it's just a plastic knife. Yeah, so let's say someone gets, all right, someone gets a knife in the hand. Well, what are we going to do? Let's bring this guy's hand back. Let's say he gets a knife actually stuck in the hand. All right. If he gets a knife stuck in the hand, then what do we do? Are we going to remove it? Are we going to remove it? No. So if it's stuck in the hand, then what we need to do, we need to put bulky padding on either side. So someone has the knife stuck in the hand like this. We're going to put a roll of gauze on one side and a roll of gauze on the other. Okay, let me show you here. So we're going to put a roll of gauze on one side and a roll of gauze on the other. Just like that. And then we need to take another roll of gauze and we need to hold those in place. All right, so we have a roll of gauze on one side, a roll of gauze on the other, just so you can see. And then we're going to roll all the way around and hold it in place. Roll it there. And now on the bottom, So we're basically holding that knife in place, just like that. So now we have the roll of gauze on either side, one right there, one right there. And we have the knife in the center, and we roll all the way around to secure the knife in place. All right, so that's what we're going to do. We'll never remove it, because what is that going to do? It's going to cause more bleeding, and bleeding is the #1 cause of shock, and shock is a life-threatening condition. So we need as much blood in our body as possible. We don't want to lose it. Okay. So if someone has an amputation, so what's an amputation? Someone's arm getting completely chopped off, or someone actually losing a finger. Would you like that? Okay. There we go. Someone actually getting their finger chopped off. I'll have to work on that. All right, so someone getting their finger chopped off, then what do we do with the finger, and what do we do with the person? Well, #1, we need to treat the person. So maybe instead of just my roll of my 4x4 piece of gauze, so this is called a 4x4 because it's 4 inches by 4 inches. So instead of a 4x4 piece of gauze, the first aider's toilet paper, I'm going to use something more absorbent. Right? This is an abdominal pad. So it looks like a maxi pad, but this is an abdominal pad. You could use any kind of padding like this. So if you had a maxi pad, you didn't have an abdominal pad, it works exactly the same. Okay? Anything that's absorbent are just modified dressings. Okay? So they don't have to be these commercially made ones. You can use a washcloth, towel, anything you have around the house. A scarf, gloves, jacket, whatever you have to apply direct pressure, because it's bigger than the wound, it's lint-free, it's absorbent, right? So that's what we want to use. Okay, so we're going to apply direct pressure to the person and bandage that up, then just wrapping directly around. Then we need to take care of the person's finger. So I'm going to go to my amputation section of my first aid kit, and in that section I'm going to have a Ziploc bag. I'm going to have an ice pack. Okay, so what I need to do is I need to wet this down. So I take my eye wash bottle or just water and spray this down with water. This is what you'd use to like wash out someone's eye. So we're going to take that, we're going to wrap the finger in a moist dressing. We're going to put it into a bag. All right, going to wrap it up in there. Okay, so the finger is wrapped up now in a gauze. We're going to take this finger and put it on ice. So you can put it in a cooler with ice, or you can put it inside of another bag of ice. Okay, so the ice is actually not touching the finger, and that's important to know. The ice is not touching the finger because the finger will get frostbite. So if you can get frostbite with your finger still attached to your body, how much more is a finger that's not attached to the body, that doesn't have warm blood going through it? How much more could that get frostbite? So we're going to wrap the finger in a moist dressing, put it in a small bag, then put that bag on ice inside of another bag. Okay, that's how we're going to care for it. We're going to label the name, the date, the time that it was amputated, and what body part. Okay, that's how we're going to care for an amputation. So anything that's chopped off, that's how we're going to care for it. So bleeding internally. So this is the last section, and then we'll take our 3-minute transition break. So here is the bleeding internally. If someone's bleeding internally, we're not going to chop them open and apply pressure, so you have to just treat for shock. Okay, and how we're going to treat someone who has an abdominal injury. So this will be the last thing we talk about for bleeding. If someone's cut across here, then we need to apply a dressing and a bandage and wrap all the way around the body. Okay, but what if someone has, actually the first one was if someone just got hit in the abdomen, they might want to be in the fetal position or curled up like this, and that's a good position for that. So if someone is cut, we apply a dressing. But what happens, the third one, is if someone cuts so deep that boop, an organ pops out. That like your intestines actually like pop out of your chest. You know, your abdomen. You know what's going to happen? Person's going to look down, see that their abdominal organs are hanging out of their belly, and they're going to pass out. They're going to hit the ground. All right? And when you get there, you're going to come to them, and you're going to see their abdomen, their intestines, sitting on top of their body. And so if that happens, we need to take a big dressing. So this one is a abdominal pad. We need to grab the jumbo dressing, right? The extra long one, and cover over their abdomen like that. We need to wet it first. So the rule is, if whatever is wet on the inside, if it's now on the outside, it needs to be wet as well. Okay? So that's what we need to do. So we need to wet this down. So we grab our eye wash bottle or water bottle, wet this down, and we need to apply this over the organs. We're not going to push the organs back in though. We're just going to apply it over the organs like that. Okay? So that's how you're going to care for someone who has their abdominal organs sitting on top of their belly. I bet you never thought you were going to learn that today. So the same thing applies for anything that's ejected out of the body, like an eyeball. If someone's going high velocity and their eyes are open and they stop instantly, their eyeball could pop out. So if someone's eyeball pops out, where's my eyeballs? If someone's eyeball pops out, boop, it'll probably be hanging there. So in that case, we don't want to pop it back in. What we're going to do is we're just going to stabilize it in place. So we can grab some gauze, like a small, maybe we can take an abdominal pad and wet this, right? And stabilize the eyeball like that and just tape it in place. Or you can put some gauze in a little small cup and put the cup on their face and tape it like that. That's crazy, I know. But that could happen. Eyeball could pop out. What about a bone that pops out? The bone breaks and sticks out of the skin. You probably saw that NBA player maybe 2-3 years ago who that happened to, and it popped out. It was his leg, and it popped out of the skin, and everyone's like, oh, just horrified. In that case, right, we don't pop it back in. We don't pop the eyeball back in. We don't pop the abdominal organs back in. We just need to have a moist dressing, right? Cover it over, and in that case, you would have to treat it for a fracture. And we do that by stabilizing the injury. Okay? So that's all the trauma. That's all those situations that we could come across for bleeding. But the way we treat bleeding is direct pressure and rest, and treat for shock. Direct pressure, rest them by sitting them down, and treat for shock. All right, that's amazing. So the last thing I want to tell you is that when someone is checking over their first aid kit, like, you know, you use all the dressings and everything, how often do you have to check it to make sure that it's stocked? And so the rule is we want to check it at least 4 times per year, quarterly. Every season, check your first aid kit, make sure you have everything that's in there. All right? So there we go. That covers our trauma section. And so I hope you learned a lot there. You're going to be able to take this information and apply it. All right, so the next section we're going to get into some testing, ask you some questions, and just kind of put the whole kind of response and thinking together. All right, thank you. And we'll see you. We'll take a couple of minute break, and then we'll get back into some more information.